Hi everybody, this is Leanne from Atlas. I'm here to chat with you about acute injuries and the best way to treat those and whether or not rice is still the best thing to do. So if you don't know what an acute injury is, it's what happens when you have one particular incident that causes you pain and you get an injury from one single thing. So that could be rolling your ankle or that could be stubbing your toe on the couch. And so this particular video is only going to relate to acute injuries in that manner. So if you have something else going on, then this probably isn't the best advice for your particular injury. And you might want to consult with your healthcare provider or one of the Atlas members that you work with. So RICE is the acronym that we've all heard to use for acute injuries. And RICE stands for rest, ice, compression, and elevation. And the idea for RICE is that it's going to decrease swelling in your tissues, which is going to help improve your healing time and also, eliminate those longer healing times that happen when things get really swollen. And this research over the last decade or so has shown that actually that's not the best option for you when it comes to treating acute injuries. Your tissues need swelling when you have an injury in order to heal. Swelling is your body's way of bringing in healthy cells like white blood cells that are going to heal tissues. They're going to remove damaged or waste products. And so you actually need some of that in your tissues in order to heal. The rest part of RICE means that you're not doing anything, you're just relaxing and you're letting your tissues do their work. What we recommend instead of absolute rest is one, limiting your activities. If you're somebody who's really active, you might need to take a little downtime, back off a little bit and do things that are a little more slow and controlled rather than going hiking or biking or running, something that you could re-injure yourself doing. So we recommend doing pain-free range of motion, pain-free exercises, and if you need guidance on that, we'd be happy to help you here at Atlas. The second thing is ice. Ice is really good at decreasing swelling and controlling pain. But like I just said, you need some swelling in your tissues in order to heal. So if you're having a lot of pain or moderate pain and you need something to control that, ice is a good option for you there. You want to limit that to 20 minutes at a time, but you don't need to just be icing all day, every day, whether or not you're in pain. If you need something to control the pain, that's the time to do it for 20 minutes. If you just did a bunch of walking and your ankle's really sore, right at that moment, ice might be appropriate, but you don't want to just be icing all day, every day, 20 minutes on, 20 minutes off anymore. That's not the best way to do it. Compression and elevation are both also really good for swelling. Compression can actually close down your lymph vessels as well. And that's also going to decrease your tissue healing time because the lymph tissues or the lymphedema is what brings in those white blood cells. And then it also carries away waste products and damaged tissue. And so you need that in order to heal. And then with elevation, it's the same idea. It might get swelling out of there, but it's not going to allow those white blood cells to come in. So instead of doing the old adage of RICE, what we recommend is doing a modified activity. And if you need guidance on that, we'd be happy to help. Icing only when you really need to control your pain. And then, kind of working your way back into your regular activities carefully and slowly instead of rushing all back in at once. If you have questions or you need help, let us know.